It'd be very important if you're worried about a loved one to know about the VMS examination. That is the mental status examination, in which we define if a person has mild cognitive impairment or early Alzheimer's disease. First, what we do is we give them 3 words to remember. Words would be something simple, like whatever color shirt they may be wearing. Let's say it's a blue shirt. Then I will point to my wristwatch saying, wristwatch. And the third thing, I will usually give them an address, like 40 Diamond Street. Then I will ask about their orientation. First time orientation is one of the first things that seems to go in Alzheimer's disease and mild cognitive impairment. I will ask them what year it is, what month it is, what day of the week. I will ask them what state they're in, where they are at the present time, and that is, where in their home are they? Are they in the living room? Are they in their bedroom? Topography, and that is where you are, is another early sign of mild cognitive impairment and early Alzheimer's disease. Now, after I give those, I then go and I ask them, can they spell the word world backwards? Well, you could pick another word. You could pick something simple like pink. And then I'll ask them to see if they could spell that backwards. And then often you have to encourage the person. From there, I will ask them to subtract 7 from $1. And remember, every time I'm asking them these things, I tell them that I am going to ask you to repeat these in approximately 3 minutes. So those 3 words that I had given, that is blue, 40 Diamond Street, and wristwatch, I ask them to repeat it immediately after I give that to them, so that I know that they've registered it. So I tell them, take 7 from $1, and I ask them what the answer is. And then 7 from the answer, which would be 93. Following that, I will ask them if they can name 2 objects, like a pen or eyeglasses, for instance. The reason for this is extremely important, is people who have maybe a stroke in the language area, they can't spell anything backwards. They can't tell you what date it is. And the problem is not that they have memory loss, but because they have a stroke. So this is a very important question. If they can't get this right, then they have to be considered that they may have some type of stroke. Finally, I will ask them to do a sequential command, and that is with their right hand, I want them to touch their left ear and close their eyes. And I will tell them, make sure you remember this. Following that, I will give them a diagram to do, and that is, it's usually some type of cube, 3-dimensional, and I'll ask them to draw that. When that's all over, I then ask, what are the 3 words I asked you to remember? Now, if they can't remember them, or they only remember one, I will then give them a hint. It was a color. It was an address. It was something that you wear. And if they get it right after a hint, you give them 1 point. You give them 2 points for each one they get spontaneously. Then I'll ask them, what word did I ask you to spell backwards? Following that, I will ask, what number did I ask you to subtract from $1? And finally, I will ask them, what was the 3-stage command? What did I ask you to do with your left hand? And, of course, at the end, I'll ask them to redraw the diagram that they had originally drawn. Now, the most important part is that last 10 points that they get when I ask for the memory. That is a clear indication of mild cognitive impairment and Alzheimer's disease. If they miss 3 out of 10, there is cause to worry. If they have 4, they probably have mild cognitive impairment. More than 4, they may have early Alzheimer's disease. Always remember, if they're taking multiple medications, if they've been very depressed, many of these things can appear as cognitive impairment, but in fact it is not. This is a good test you can give your loved one, and it is a way to being able to tell, do they have mild cognitive impairment or early Alzheimer's disease? And if they do, if you believe that there is a problem, make sure you get to see your physician and see a neurologist.